Okay, before starting the assessment, I want to make sure that I've gathered all of my equipment, that I've provided privacy for the patient, that I've washed my hands. So upon walking into the room, I just want to look at the patient's general appearance, make sure that his clothing is appropriate for the weather, and it is since we're inside. Look at the patient's hygiene, make sure that I don't notice any body odor or disheveled hair or anything like that. He's shaven his face and appears to be clean. I'm then looking at the patient's posture too as he's sitting here, as well as his skin throughout the entire assessment, making sure that it's warm and dry, that I don't see any abnormalities, masses, any skin issues that the patient might report. Later on, I will look at the patient's mobility. I'll just have him take a couple walks, and you can go ahead and do that actually now if you want to. You can just walk that way, making sure that that is all symmetrical when he moves, and then you can walk backwards. Okay, and then bend over and touch your toes, and I just want to make sure that when he bends over, I don't see any deformities in his spine. I also want to assess the patient's orientation. I want to make sure that he can tell me, you know, who he is, where he's at, why he's here, the year, the date, those sorts of things. I'm also going to assess the patient's affect, his mood, his speech, and his hearing throughout the assessment. Other things I'm going to be looking at as I'm talking with the patient is eye contact, and then his level of consciousness. Is he alert? Is he awake? Is he interacting with me? So first thing, I just want to look at the head. I'm just going to look at it and make sure that there is no deformities, that there's no unsymmetricalness to his head, and then I'm just going to palpate his scalp and his cranium, make sure that I don't feel any lesions or masses or any tenderness anywhere. Then looking at his face, making sure that it's symmetrical. I'm going to feel his temporal artery, make sure that it's strong and equal, and I can feel it on both sides. And then I'm going to feel the temporomandibular joint, so I'm just going to have the patient open his mouth and close. Make sure I don't feel any popping or clicking there. And then any pain or tenderness in your sinuses here. You feel any pain or tenderness there?
No, ma'am.
Okay. And that's checking his maxillary and frontal sinuses. I'm then going to do the confrontation test. So I'm going to ask the patient to tell me what number he sees and when he can see it.
2.
Okay, and then I'm going to come over here.
2.
Okay, good. And then I am going to check his light reflexes. So I'm going to check his right eye first and then his left eye. And then I want to make sure that when I shine it here, that we also have constriction over here. So I'm just going to shine this in your eye. Look straight forward. Okay, good. And the other side. Good. And then back over here. Okay. And back over here. Okay, good. And then I just want the patient to follow my hand only without moving his head. So this is checking his cardinal reflexes. Okay, good. Then I'm going to look at his eyes, including his conjunctiva, his sclera, making sure that it's white. There's no yellowing in the eye. Looking at his corneas, making sure they're symmetrical and there's no abnormalities noted there. And then the pupil size, which I kind of looked at that when I looked at the light accommodation with him. And then for the Snellen chart, if we had one of those, we would have the patient cover one eye, and then he would read me the lowest line of what he could read. I do not have an otoscope. I could not get one. But if I was going to use one, the first thing that I would look at was just looking at his ears, looking that they're symmetrical, that I don't see anything on the outside of the ear. And then I would take the otoscope and pull his pinna up and back, shining it down in there, looking at his tympanic membrane and the canal, looking for excessive wax. And then when I look at the tympanic membrane, it should almost be clear. If he had any scar tissue, I would see like white patches in there. Then I just want to look at the nose, make sure that it's symmetrical, that it's straight. And then I'm actually going to look up in his nose and look at the mucosa, the septum, and the turbinates. So just have you tilt that. Good. And then I'm just going to have you breathe out and breathe out, breathe in and breathe in. Just checking the patency of his nose there. Next thing is I want to look in his mouth, looking at his buccal mucosa, his teeth, his gums, his tongue, the floor of his mouth, just making sure that I don't see any lesions or any red, white patches, anything abnormal in the mouth, any missing teeth, rotted teeth, that sort of thing. Also looking at his uvula as I'm back here. Raise your tongue up. Okay. And can you say ah?
Ah.
Okay, good. Okay, so moving on, I would check the patient's gag reflex. I'm just going to have you open. Okay, good. Then I want to look at his neck. I want to look at it and, you know, like everything, see if I see anything that's out of the ordinary here, making sure that it's symmetrical. Want to look for any pulsations that I might see in the neck, any masses that I might feel. Also looking to see if there's any jugular vein distension or pulsations of it, and I do not see any. Then I want to feel the carotid pulse. Okay, and then the other side. Okay, and then next I'm going to palpate the trachea and then the thyroid, sliding my finger in here, and just again checking for any tenderness, any lesions. Does any of that hurt?
Mm-hmm.
And then have the patient swallow. Okay, good. Also feeling the lymph nodes of the neck and the head and making sure that those are not tender, that I don't feel any swelling of the lymph nodes is important. So then I'm going to look at the chest area, just again making sure that there's equal expansion when he breathes. And actually, if you want to take this off, that would be great. So I'm going to look at his chest. Can you take a deep breath? Okay, and exhale. So just making sure that it is expanding and releasing the same, that it's symmetrical. Then I want to look at his shoulders, and make sure that those are also symmetrical, that there's no abnormalities noted there. All of his muscles appear to be symmetrical as well on both sides. And then just feeling for any tenderness or masses anywhere in his chest area. Does any of that hurt?
No.
No pain in the chest area. And then I'm just going to percuss on his chest area. And I'm just making sure that they are symmetrical sounds on both sides. And then I just want to listen to him. So every time I place my stethoscope, if you could just take a deep breath in and out. I'm going to listen to the inner 1/3. And then second intercostal. normal here. Okay, good. And then I'm going to listen to the back side here, avoiding the scapula area, so T1. Deep breath. And then if you could just whisper 99 every time I place my stethoscope. Okay, and I'm just listening to make sure that I can't hear him through my stethoscope. If I could, then sometimes that could mean there's some congestions within the chest area. And then we'll listen to the heart again. I listened to him on the lung assessment as well. Next, moving on to the upper extremities, I want to palpate his radial pulse, making sure it's strong and equal. Next, I want to palpate his brachial pulse, same thing, making sure it's strong and equal. And it is, and then I'm just going to have the patient squeeze my hand to check for muscle strength and symmetrical strength in both hands. And then if you could raise your arms up and out to the side, okay, and back to the front. Good. And I just want to make sure that the patient has active range of motion in his shoulders and all of his upper extremities. Next, I'm going to look at the abdomen. I just want to make sure that the contour is normal, that it's symmetrical. Any abnormalities in his skin here as well, and I don't see any here. And then making sure that there's no abnormality with his umbilicus here, and it looks good and symmetrical. And then I'm going to listen to his bowel sounds and his vascular sounds here. So if you want to lay back. Okay. And then I'll listen to your groin area here. Don't want to hear a bruit or anything here because that could indicate an abnormality with the blood flow. Okay, that sounds good. And then I'm going to just palpate all of the quadrants, make sure that there's no tenderness, any tenderness here.
No.
Okay. And then palpating the liver and the spleen. And any tenderness there?
No.
Okay, and that concludes this assessment.